Hi, my name is Mattie Jones and I am recording my practicum for health assessment. Hi sir, can you state your name?
Tim?
And do you mind being recorded for this assessment and putting on YouTube and our instructor viewing it?
No, that's fine.
Okay, alright, so we'll get started. I'm going to get my hands clean over here for you. First off, I would just like to start off by, can you give me a little bit of your health history? What's going on?
I've got high blood pressure.
Okay.
I've got a lazy eye on my left side.
Okay.
And I have got a little bit of acid reflux.
Okay, alright. And can you tell me your height and weight?
I am 5'11" and 210 pounds.
Okay, so we're going to start off by using our Snell and eye chart over here. So I'm just going to have you stand right here as far close to your shoes there as possible. And then cover up either your left or your right eye for me. And then read the lowest line possible.
EDFCZP.
Okay.
And the one right below that's FELOPZD.
Okay, can you try this last one here then for me?
DEFPOTEC.
Okay, so that would be 20/20 and your right eye. Can you uncover and then cover, yeah, that's right, cover your right eye. And then your lowest with your left eye.
EFP.
Okay, and can you try this third line for me?
I cannot see anything on that line.
Okay, so that is due to your amblyopia for your lazy eye. And then can you uncover and keep your eyes uncovered and read the lowest line possible with both eyes?
PEZ. Oh, I'm sorry, I was at the very bottom one. So DEFPOTEC.
Okay, and then can you go lower with both eyes?
LEFODPCT.
Yes, sir. All right, so that is a 20/15 vision with both eyes. You can have a seat here for me. All right, and so I'm just going to go ahead and get some vital signs here by checking your radial pulse first. Alright, so we have a pulse rate of 64 in the radial, +2, which is good. Alright, and then I'm going to check your temperature here. I'm just going to put this under your tongue, and then it'll beep when we are finished. Should almost be there. Okay. Alright, so we have a temperature of 98.9. Also did respirations at that moment. We got 16. And are you in any kind of pain today, sir?
No.
Okay. Alright, we're going to get your blood pressure as well. If you could just hold your arm straight for me. Alright, and just try to relax it, laying it down on the bed there for me. Alright, so we have 136/70. Oops. Okay. Alright, so I'm just going to take a look at your skin, what we call skin turgor here, and it helps us test hydration within normal range, and looking at your hands here, looking for any signs of clubbing within the nail bed, and cap refill is within 3 seconds. Check his other hand here. Skin turgor is good, no signs of clubbing, and cap refill is less than 3 seconds. Alright, sir, so now I'm going to move on to your head and your face here. So I'm just going to be looking at your scalp. So if you lower your head down here for me, noticing any signs of swelling, tenderness, any nodules that I may feel, or I could even be checking for head lice or any type of situation like that. Alright, sir, so just face me forward. Give me the biggest smile that you can give. Good job. Okay, you can raise your face like normal. Close your eyes as tightly as you can. Open them, and then raise your eyebrows as high as you can. So these are testing some cranial nerves for us, and then all things are symmetrical. If not, that would be signs of history of a stroke or having a current stroke. So next I'm going to feel the temporal artery to see if it's bounding, normal pulse. +2 here, feels normal on both sides. And then I'm going to look at your and feel your temporomandibular joint here. Can you open up for me and close? Was there any tenderness there? Did that hurt when you did that? Okay, so there were no signs of popping or spasticity either while he did that. So now we're going to do some visual testing for us. I'm just going to have you cover one eye for me, and then I'm covering my opposite eye. And then what you will do is tell me when you can see my finger start to wiggle.
I can see it.
Okay?
I can see it.
Okay?
I can see it.
Okay?
I can see it.
Okay? And then we're going to do our other eye as well. So, yeah?
I can see it.
Okay?
I can see it.
Okay?
I can see it.
All right.
I can see it.
Peripheral vision intact in all fields. All right, and now we're just going to test for what we call accommodation. So I'm just going to have you follow my pen light towards your nose here. Left eye does have an issue following and accommodating due to lazy eye. Next, we're going to turn off our light here. Excuse me. We're just going to do some more testing with your visual field. So So first I will do the red reflex. So I'm just going to have you look forward for me. Alright, so at this moment I see the reflection of the light through his pupils. And now I'm going to look into your right eye with my ophthalmoscope, looking for the retinal background. Okay, so we're just going to get nice and close. And then adjusting vision here until I can finally see the disc, which would be a distinct circle. Lower retinal background should be a pinkish red, and I should see 4 main vessels. I'm noticing for any hemorrhaging or signs of scarring. And next we'll do the left eye. Same thing, we are looking to see the retinal disc, background, and the main vessels. Okay. Normal range there. Alright, we're going to turn our light back on. Alright, and next I'm going to be looking into your ear. So I'm going to pull slightly back on it here for you. Any tenderness there or pain?
No, ma'am.
Want to do that? Okay. Alright, so we are checking out the tympanic membrane. Should be kind of a glossy silverish color. If not, that would be a sign of otis media, so an inner ear infection. And your other ear, please, sir. Same thing, any pain or tenderness?
No, ma'am.
Okay. Same thing applies, looking for the tympanic membrane. It is there, no signs of redness. Okay, so now I'm going to look, I'm also looking at your outer ear structures. There's no eyelid drooping, no obvious signs of trauma there. Going to pull your eyelid down here, sir, checking out your conjunctiva, nice and pink. At the same time, I'm looking at this sclera to see if there's any yellowing. All within normal range here for him. All right. So now, sir, I'm going to be doing what we call a whisper test. So normally I would get at least 2 feet behind him and repeat this, but this room kind of doesn't allow for that spacing. So, sir, what I'll have you do is just repeat what I say to you. 1M4.
1M4.
Okay, correct. If he did not get that answer correctly, I would try a different amount of letters and see if that works for him. So now, sir, I'm just going to look at your more of your facial structures. We're moving on to your nose. I see it's not quite midline. Has it ever been broken or anything in the past? Okay. All right, so we're going to check for any deviation in what we call your septum, your bone here. So if you could slightly tilt your head back for me, I'm going to place this instrument into your nostrils here and just take a quick look. So there is slight deviation here, but the mucous membranes are moist. No signs of turbinates being protruding. Good there. Thank you, sir. And now we're going to move on to your mouth. So I'm just going to open up for me, looking at any teeth issues, hard palate, his soft palate. Again, he is nice and moist there. So I'm going to get my tongue blade and I'm going to test and check his uvula. Can you spread your feet for me just a little so I don't step on those? All right, so I'm going to have you open up real nice and wide, putting the blade on the lateral portion. Stick your tongue out kind of more for me. Thank you. And then say ah. All right, very good job. And the tonsils are present. No overcrowding there, normal position to be a +2. At that time, if I felt I needed to test his gag reflex, I would put that tongue blade on the posterior wall of his tongue to elicit that. And then one more thing with your tongue for me, if you can stick it as far out as you can, and then move side to side. Awesome, good job. So we are now going to move on to your neck. Here I'm going to feel for your cervical lymph nodes. If you could just tilt your head there for me just a little bit. So while I'm feeling, I'm going to ask him for any tenderness, If I find any swollen lymph nodes, I would mark the size, the location, if it was hard, if it was movable, or if it was fixed. And from there we would move on to see if there would be any further diagnostic needed. Also going to check his sinuses here. Any swelling or tenderness in any of the areas that I felt? Okay, awesome. So then we're going to look at his trachea. So tilt your head there back for me a little bit. So I'm going to press on your neck here. We're going to see if there's any trachea shift, moving it left to the right. And it is not, so that is normal. All right, now I need you to rotate your neck from left to right as far as you can go. Okay. All right, shrug, that's good. Now shrug your shoulders for me, and down, and then with resistance here. Okay, all right. All right, and so now I'm gonna just go behind you here and feel on your thyroid. So you're gonna tilt that head again kind of for me backwards, and a little bit to the left actually. Then I'm gonna feel for his thyroid, pushing on the left. Swallow for me. Okay, and then on the right, and then swallow for me again. I should not feel the presence of his gland. There's no swelling there. Okay. All right, sir, so now I'm gonna have you lay down here on the bed. And I'm gonna raise the bed up some, just so I can reach you better. Okay, this time let me move around to the right-hand side for us. We're going to be looking at the jugular vein here. So if you can turn your head slightly to the left for me, looking at this posterior to the sternomastoid. Okay, so there's no obvious pulsations out of the ordinary. If there was, I would test for distension here using the angle of Louis test. Also look forward for me. So also need to do the carotid as well. If it's bounding to touch here, I would then test for bruit by listening for any along this midline here. If there was a bruit present, that would be a sign of narrowing of that vessel. All right, sir, so I'm gonna have you just lift your shirt up here a little bit. I'm gonna feel on your pericardium here, and just breathe normally for me. I should not feel any sort of vibrations or heavy heart beating either. Okay, that's normal. I'm now gonna find the apical impulse by going to the 5th intercostal mid-clavicular line. Okay, and then I'm going to listen to the apical rate. For a full minute. So we have a rate of 72 apical, regular rhythm. So now I'm going to be listening to the 4 heart valves, starting with a second right intercostal at our aortic valve for any murmurs. Okay, and then moving to our second left, which is our pulmonic valve. Okay, going down to the left lower sternal border for our tricuspid valve. And then last but not least, the fifth intercostal, which is our last valve, our mitral valve. I will repeat this by using the bell of my stethoscope. Okay, so I'm going to leave your shirt up for this portion of the study. I'm now going to be looking at your abdomen. First noticing if there's any protrudence, any distension, or even scaphoid, all with a normal appearance here. Is there any pain or tenderness in your belly, Tim?
No, ma'am.
Okay, so first I'm going to hear and listen for all vowel sounds, and starting in the 4 quadrants. Noticing if they are normal, hypoactive, or hyperactive. All vowel sounds are normal in all 4 quadrants. While I'm listening, I'm going to try to find his aorta pulsation. And then listen to it and see if I hear a bruit here. If I did, that could be indicated of a aortic aneurysm. Okay. All right, sir, so now we're going to move on to palpating your belly. So first I'm just going to start with some light palpation. Any tenderness in this area?
No, ma'am.
Okay. How about here?
No, ma'am.
Okay. All right, now moving on to deeper palpation. Deeper palpation will let you locate any masses. Okay, and there's no rebound tenderness during that exam either. So now I'm going to feel for his liver, spleen, and his kidneys. So sir, I'm just going to have you take 9 slow, deep breaths in and out. Put my left hand behind your back here. There we go. Nice and slow. As he exhales, I'm going to move my fingers up under his rib. If I was able to feel the liver, there may be a small regular ridge here. If more than that, it'd be indicative of his liver being swollen, so further testing would be needed. Now we're going to move on to the spleen. This area would be tender. If I did believe that there would be an issue here palpating it, I would need to be very gentle because it is easy to rupture. Okay. And last, his kidneys. Okay. Usually they are difficult to palpate. And now his left kidney, which is a little bit higher than the one on the right. Okay. Now going back to that aorta. So what I would do, I would press down and feel this pulsation. And then I would also kind of move my finger outward to see when I feel that pulsation stop. If it is more than 2 centimeters, that would be of a concern, and I would need further testing involved for him. Last but not least for the abdomen, I'm going to do a little reflex test. So sir, sorry, I'm going to have to lift that shirt back up. And so what we do is we do a light scratch on the abdomen. There should be some contraction as if he's being tickled. Okay, there we go. Also, we would be looking for any signs of a hernia, any type of issues with his umbilicus. There'd be a possible hard or rounded area near that, near his belly button. And next but not least, we're going to do some pulses check here. So starting at his feet, the Lepris dorsalis pedis. He actually has a scar on his right foot. Making it a little bit more difficult to feel that pulse on that right leg. So I would also get a Doppler ultrasound to test that out. Making sure these pulses are not bounding or thready. Also going to check out cap refill with a normal range on both feet. Also going to check if there's any fungus with the toenails or odd growths, hanger toes, bunions, anything of that nature. And typically, if this was a real exam, I would also have him in a gown so we could test his popliteal pulse by just lifting his leg up ever so slightly. Okay, and again on this leg. Okay. All right. Also would be noticing for any signs of swelling, modeling in the legs, the lower extremities, which he is clear of, and cap refill, of course, was present. Next but not least, going to test some muscle strength here. So I'm going to have you bend, sir, at your knee, as high as you can bend your knee. There we go. And back down. Now your other leg. Good job. And down. Now lift one leg at a time from your hip. Lift your leg straight up. Yeah? There you go. And your other leg. Okay. Moving down again towards the feet. Can you rotate your ankles for me? There we go. And then push on my hands, like your toes to the sky. Good job. And then down on my hands. Perfect. All right. So push this back down. All right, sir, I'm going to go ahead and have you sit back up. Okay. Also checking mobility as he moves from position to position. All right, we are finished, sir. Thank you very much.
Yes, ma'am.